Convective transport. Convective transport is also known as pore transport or aqueous transport, because in convective transport the drug molecules take place, the transfer of drug molecules take place through the special pores which are transplanted at the cell surface या cell membrane, and these special pores, they are known as aquaporins. Aquaporins, they are proteinous substance. They are homotetramers. They are homotetramers. Cylindrical shape, filled with water, and the pore diameter is 10 angstrom. The aquaporins, the one aquaporins transport approximately 3 billion water molecule per second, and they are bidirectional. The water can move from cell into the extracellular fluid or from the extracellular fluid into the cytoplasm. They are bidirectional. So in convective transport, the drug molecules, they moving along the solvent. Along this solvent, the drug is dissolved in this extracellular fluid, which is mostly water, and this drug, after dissolving in this water portion, they move along with the solvent into the cytoplasm. That's why this phenomena is also known as shifting of the solvent. The rate of absorption through this mechanism is, this is the rate of absorption is equal to R square N A delta C divided by this one and H1, where this is the rate of absorption, this is the radius of the pore, this is number of pores, surface area of pore, concentration gradient. This is the viscosity of fluid in the pore, and this is thickness of the membrane. So the rate of absorption is directly proportional to radius of the pore. Greater the radius, greater will be absorption, because the drug move along with the solvent. If number of pores is more, so greater drug will be transported, and if the number of pores less, lesser drug will transport. If the surface area of pore is greater, the rate of absorption will be more. If the concentration gradient is more, again the rate of absorption is more. Without energy, the drug will transport from higher concentration to lower concentration. If the viscosity of fluid within the pore is more, if the fluid within the pore is more viscous, the rate of absorption will decrease. If the thickness of membrane is more, again the rate of absorption will be decrease. As the pore diameter of aquaporin is 10 angstrom, that's why mostly that electrolytes or molecule can transport within this range. However, the higher molecular weight electrolytes or drugs or any endogenous exogenous substance can cross this aquaporin if the shape is spherical or chain shape. If they are irregular shape, they cannot cross this aquaporin. The example of the drugs which can pass through this pore are organic and inorganic electrolytes up to molecular weight 400. They can absorb dextrose, fructose, electrolytes, urea, cimetidine, loperamide, atenolol, and mannitol. Thank you.